In this video, I would like to talk about the condition diabetic eye disease. In diabetes, it is the retina or photographic film at the back of the eye that is primarily affected, and the risk of this developing increases with the duration of diabetes, poor blood sugar control and poor blood pressure control. The blood vessels that are primarily affected are the capillaries, the small blood vessels where there is an exchange of oxygen and nutrients to the retinal tissues. And the capillaries can do one of two things. They can either become leaky or they can become blocked. When leakage is a problem, it usually affects the central part of the retina, or the macula, the area we use when we look directly at something that gives us detailed vision, reading and writing vision. And as a result of this leakage of fluid from the blood vessels, the central retina or macula swells. It's sometimes referred to as diabetic exudative maculopathy, and this produces a gradual blurring of vision. If blockage is the problem rather than leakage, it tends to affect not the central part of the retina or macula, but the peripheral retina. So sometimes you can maintain good vision in terms of reading vision and have very poor circulation in the peripheral retina, which goes unnoticed. If the poor circulation is getting quite severe, the retina tries to improve the situation by producing a molecule called VEGF, vascular endothelial growth factor, which stimulates new blood vessel formation. You would have thought that new blood vessels are a good thing in the situation of a poor circulation, but unfortunately these new blood vessels are not beneficial to the eye because they grow forwards from the retina into the clear jelly that occupies the main eye cavity, or the vitreous gel. And this vitreous jelly can then pull on these abnormal blood vessels and cause them to rupture, resulting in a sudden loss of vision with increased floaters and blurring of vision as the whole eye cavity fills with blood from these ruptured blood vessels. So that's why diabetic screening is so important, to look for early signs of leakage before it affects the central vision, and to look for signs of these abnormal proliferations of blood vessels in severe poor circulation, a condition sometimes called proliferative diabetic retinopathy, because there is this proliferation of blood vessels. So this needs to be spotted before the blood vessels rupture, so it can be treated at an early stage. So screening on an annual basis is an essential aspect of the management of diabetic eye disease.